Welcome to OPENBXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Also, if you're watching us on cable, you can continue to stay up to date with our on-screen social media feeds, providing the latest COVID-19 community updates and important headlines. The lack of COVID-19 tests are a cause for concern for many uninsured and immigrant families. Forme Medical Center recently opened a COVID-19 testing site dedicated to providing services regardless of immigration status or insurance. Joining us now to tell us more is Maria Trusca, CEO of Forme Medical Center. Thank you for joining us, Maria.
Thank you so much for having me. It's a pleasure to be here.
I see you're at Forme right now. Can we just learn a little bit more about the facility?
Yeah, so for the past 5 years, for me, it's been a mission that I took on. I've been in healthcare over 35 years. 26 years, I was with the affluent community in Scarsdale. I was the executive director. In 2015, I left to fulfill a mission to focus on providing access to care to the uninsured community, especially the undocumented population. And I joined my partner, Gina Capelli, in 2015, and we created this amazing center for this community. So we've been caring for the uninsured, undocumented population for over 5 years now. And when the situation happened with COVID, we were completely desperate because we were getting 300 phone calls a day. And let me tell you, we couldn't find a place to send our patients to be tested. It was pretty devastating.
And now just some leading straight into it. Tell us about the COVID-19 testing available for this community, the uninsured and immigrant community, and why it was important for Forme to provide these services to this group.
Well, as I was saying, we were struggling to send them anywhere. We were getting 90% of those 300 calls. They were with COVID-19 symptoms. So out of desperation, I remember being in my office one day and I started to cry. I called my kids and I'm like, I feel like I can do nothing for my patients. And the doctors were calling me and asking me, because we have primary care, we have urgent care, we have gynecology, podiatry, neurology. And our doctors were like, Maria, they come to me. Where do we send these patients? And I started to call the Department of Health. And for number one, I don't know if you know, but the Department of Health did not have a menu in Spanish. I called the Westchester Medical Center, that in Westchester was one of the first testing sites, aside from the one in New Rochelle. And when I called there, again, no menu in Spanish. Number two, they were asking for you to go in a car with an ID. I ended up being tested myself. I went through the process and I said, there's no way that the undocumented population is going to be able to get tested here. So we continue to get roadblocks after roadblocks. And my concern was that because we were not testing them, they were actually not believing that they had the virus. Many of our patients used to say, it's a regular cold. I get this every year. It's not a big deal. And we're like, no, we need to test you. And now, if you add up the fact that they live together, 5, 10 people in a house or an apartment, sharing bathrooms, sharing the kitchen, we started to get more and more calls. So we decided, you know what? We're going to take this in our own hands. We need a walk-through facility. They can't go to any place. There's no place for them to go. Yeah. So we decided, my business partner and I, even though we're not government subsidized, we didn't have the money from the government. We said, you know what? We're going to do it. So we team up with Quest Diagnostic. We opened up a walkthrough facility. So we put a tent outside, and that's where we're doing the COVID-19 test. People can come in. We don't turn anybody away. We're charging $25 for collecting the test. But if you can pay it, we don't charge you. Because I have to charge something, because honestly, the amount of support that it takes to be able to manage the patient flow, we have about 5 people just to manage patient flow, registration. We have a call center in Mexico that is handling 600 calls a day. But we said we don't turn anybody away. You can, we have patients that say, I don't have the 25, you come and get tested. We don't care. Because the idea is that we need to test them. And let me tell you that we are getting many positive tests.
Mm. And Maria, if somebody's listening right now and they want to go to one of these centers, where are they located and how can people access them and make appointments?
Yeah, so unfortunately, I'm yet in still in White Plains, New York, but we're coming to other places soon. That's the goal. But if we are at 711 South Broadway in White Plains, New York. We are centrally located, so there is, we have bus, train, everything is near us. And they can just go into our website, formemedicalcenter.com, or again, they can call. Our number is 914-723-4900. We urge people, if they can, but if you're not able to navigate the website, you can call. But we also urge people to go into the website because they can register right on the website and they can choose Spanish or English.
Right. And Maria, what happens if a person's results come back positive? How will Forme follow up with this patient?
Every patient talks to a provider. They talk to either a nurse practitioner or a PA or an internist. And the idea is not just to get the results, but educate our community and help them understand how critical it is that if you get tested positive, that you protect your family, and we give them instructions. So it is about preventing them from continuing to spread the virus. In addition to that, we're starting to do, at the beginning when we set up last week, we were not doing the checking the oxygen level and the temperature. But as of today, we were able to set up so that everybody gets their oxygen level checked and everybody gets a temperature check, because the oxygen level is something that, we can prevent somebody from ending in a situation where they die. Because if the oxygen level is below 95, then you really need to go and go to the hospital before it gets to the point where it's, they're not going to be able to help you.
Right. Can we also learn a little bit about the virtual medical appointments that are also available by Forme and how people can access this service?
Yes. So we're here. You can schedule an appointment 24/7 because we happen to have a call center that is our receptionist. Basically, they all know how to make the appointment. So 24/7, you can call and make an appointment for virtual visits with the doctors. And for the ones that don't have insurance, again, we charge a minimal amount of $60. But if they can't, I also make sure that everybody gets seen. We also take the insurance, and they call the number, the 914-723-4900. And they could also go online and book the visit. I'm happy to announce that we are preparing to be open on Friday. We're going to do a soft open just to make sure that, because nowadays, these are new days of treating patients. So everybody has to get gloves for when they come here, when at the front desk, before they get in the building, they're going to get gloves. We got to make sure everybody has a mask. We are doing the intake outside from their car, or if they, from their house, and then they come in and they get seen. So it's a whole process to make sure that we are protecting our patients and protecting our staff and the physicians.
Right. And one last thing before you go, Maria, just a message for the community, the undocumented and immigrant community at this time in regards to, what's going on and COVID-19.
My biggest concern right now is, as we are talking about reopening and everybody's getting so anxious to get out, is that we are going to really hurt ourselves because we are not being careful. And even if you want to get out, and I know that the economy, everybody's hurting and we need to get back into having a little bit of normality, we need to be very, very careful. And the scenes that we're seeing on the TV and on social media of people hanging out, dancing, they're not taking this serious. And let me tell you, we are at the front line and we are seeing the pain. I just got a call today from a Dominican a man that lost his father this week, and he is trying to get his father. They were visiting here, and he is trying to get his father's body back to the Dominican Republic, and he might not be able to do that. And we see all of these young people also dying. I'm seeing friends of mine that are healthy, that are in their 40s, and they're having side effects from the virus where they having a hard time walking. This virus is no joke, and it's showing other symptoms and it's showing other illnesses. So please be careful. Don't think that we're ready to just go back to normality. We're not. And you have parents and grandparents that if you think the younger population that it doesn't affect you and you're safe, you could be causing the death of a loved one. How do we live with that? So please be very careful, please.
A very important message. Thank you so much, Maria Trusca, CEO of Forme Medical Center, for joining us today.
Thank you so much for having me. It's truly an honor to be here.
We will, of course, have this interview in Spanish as well on Diálogo Abierto. We are trying to connect the producers with you in order to get this message out to our viewers in español también.
Lo aprecio mucho. Lo necesitamos.
Claro. Please visit formemedicalcenter.com for more information and to access COVID-19 tests for those who are uninsured and immigrants as well. OpenBXRx will be right back.